Good afternoon. What is the nature of difficulties that you're facing?
Yes, so Kemini, you know that most of these hospitals have majority of the nurses being members of the Ghana Registered Nurses and Midwives Association. And so once they have totally withdrawn their services, a visit to some of the hospitals in the northern and Savannah region indicates or revealed that the few nurses who are on duty are not enough to take care of the patients who troop to these facilities. Now, for the Salaga Hospital, for instance, most of the nurses on duty this morning are students from some of the nursing training colleges who have come to do their clinicals. And you know that the students have limitations, and so they are unable to do everything. The few nurses who belong to other unions or associations, even though they were on duty, but their number is not enough to be able to take care of most of the patients who arrive. Some of them are critical care patients, and so they have visited the various units to access their services. Unfortunately, they were told that they were not on duty, and so they had to use other means to go and look for other prescribers to attend to them. Let's take a listen to a patient at the Salaga Hospital who spoke with me.
Oh dear, because my son, I am pompon, a pipe. As you know, but the same in Ticasa, meaning I had to mentally, and I was saying, Mamma, come, I say, and I'm seeing in the share of fire, I was sharing of which I'm standing there. I haven't better cake and bring more fire now.
What is almost strike there?
Well, Christopher, we just heard from that woman who obviously needs medical attention. But what is the message you're getting from hospital authorities regarding how they're going to fill in the gap?
Yes, so they have actually expressed worry over the strike and how it is impacting on healthcare services at the Salaga Hospital, even at the Central Hospital in Tamale. Now, they have also adopted in-house measures to ensure that they are able to deal with the numbers that come to the facility. Now, one of the measures has to do with the fact that they have been able to, as it were, engage the students to take care of some of the issues while the other nurses belonging to the other unions do the overtime. That is what the hospital management told me. They have been able to motivate some of these nurses to do overtime so that they can catch up with the 24-hour service delivery that they have taken upon themselves to do. Let's take a listen to the administrator of the Salaga Government Hospital.
Because of this strike, the fact that Salaga Hospital is the major referral center, the strike is having a huge toll on us. Even though
well, Christopher, due to the poor audio there, we are unable to play the full content of it, but perhaps you could fill in the gaps for us. What exactly did he say?
Yes, so basically he is saying that because of the pressure that the hospital receives from patients, they had to talk to the nurses on duty to, as it were, extend the hours that they work. If they are supposed to work 12 hours, they have been able to talk to them to agree to work 24 hours so that they will be able to fill in the gap. Some of the students who also were on clinicals have all been called to come to the facility to support the staff who are there to be able to render the services. Once the members of the Ghana Registered Nurses and Midwives Association are on strike, doesn't mean that the hospital should be closed. They are doing everything possible to ensure that service delivery is given to the people.
Christopher, we'll leave it here. Thank you so much for talking to us. Christopher Mwako is a Northern and Savannah regions correspondent. As you heard from him, some health workers are at post, nurses and midwives alike, because they belong to different unions. One of such union is the National Association of Registered Midwives Ghana, NAM Ghana, and its president, Letitia Saba Atia, over the weekend on Hot Issues told me they are not in support of the strike. However, they do look forward to the government signing and implementing the conditions of service. Take a listen. Are you in support of the strike or not?
We are not in support because the due process, we did not finish we couldn't complete the due process because we were yet to meet the finance minister. So that is our stand.
I see.
Yes.
Do you think this strike could potentially harm your ability to negotiate?
Well, for us, we think that we should go back and negotiate. Even though the agreement has been signed, it has been signed. We all know that it has been signed. It's only that there were some challenges that they wanted to resolve those challenges, especially our PIN renewal, and then the professional development side too. So I think these were the two challenges that the minister was always talking about. But
I see. So in order to facilitate the implementation of the collective agreement.
Yes, I think the minister, what he said was that they want to put 3 committee members to look at it, how it will be paid. Because the PIN renewal, we were doing it ourselves yearly. We were renewing our PINs. Then we now want the employer to do it for us. So he was like, where will they put it? Is it that it will be in our pay slip, or how are they doing it? So he wanted to organize some committee members to deal with things like that. And some of the condition of service, the facilities, our various facilities are to be responsible for the payment of some of the issues. So I think these are the things that the minister wanted to work on.
Letitia Tia is president of the National Association of Registered Midwives Ghana. That is a union within the health services, not in support of the strike, although they want the conditions of service implemented as soon as possible. There will be more from across the regions on this, seeing how the full-blown strike by members of the GRNMA is biting as far as healthcare delivery is concerned. Right now, however, let's have a conversation with Dr. Marquette Nawani. He's chairman of the Health Committee and member of Parliament for NAPDAM. Honorable, good afternoon to you. I appreciate your time here. But, you know, the GRNMA threatened a full-blown strike today. And indeed, they have gone on that strike. We're seeing patients already struggling to receive healthcare services. How does this come to you as a committee?
Hello.
Yeah, hello, Honorable. Can you hear me?
Yeah, the line is not clear.
I'll take it again.
Yeah.
I'm asking how this full-blown strike and all the circumstances surrounding it come to the Health Committee, who have unfortunately been rather quiet on this matter.
I'm sorry, but the line is not clear.
How does the strike come to you as chairman of the Health Committee?
The strike, it's unfortunate. It's very unfortunate it has gotten to this stage that a strike has been declared. But I believe that we still had enough room to negotiate, because most of the conditions of services that are stated are not something new. It's things that we have been talking about. It's things that were somewhere years back being implemented. I don't know whether now they've not been implementing it, or there have been delays in implementation here and there. But there are issues. Yeah, there are issues that actually both sides need to sit down and discuss. If you take into consideration the fact that it's since May 2024 that this agreement was reached, and for so many months, June, July, up to December, that's 7 months, it was not implemented because of what they called legal challenges. And the legal challenge was resolved immediately after the elections. And so we have gone for 4 months, and it has not yet been implemented. I understand that there's a committee that has been set up, and the negotiations have even started. But somewhere along the line, things have gone bad, and so we have the nurses withdrawing their services.
Mm-hmm.
Yes. If you look at the grievances, like I'm saying, yeah, some of them, but there are some to which you find.
No, but you see, Honorable, I don't think that the nurses' strike is based on the content of the agreement. What they want is the agreement implemented as soon as possible. In fact, immediately, which is why the strike has been escalated to a full-blown strike. What exactly has the Health Committee been doing since the declaration of the partial strike?
Come again.
I'm asking what your committee has done since the strike declaration.
The committee has been speaking to the executive arm of government, trying to find out what is happening. Mm-hmm. We are currently speaking to the leaders of the Nurses Association, but I understand either their president and other president, 1 or 2 people are out of the country, and so we've not been able to speak to them. We are calling for a meeting tomorrow among ourselves to discuss this issue thoroughly. But if you look at, let's look at the condition of services, and you see that majority of them are things that I believe that the government will be ready to discuss, and like payment of incentives to rural nurses. This issue has been there for some time now, and I believe that it is the quantum of money that they need to discuss, like supply of uniforms. Supply of uniforms, the government used to pay 400, and now they are demanding about 1,000 Ghana cedis for that. So, looking at all this, but look at one of their demands, the payment of the 13th month salary.
I see.
Of the 13th month salary. That one, during the COVID time, they paid the 13th month salary as an allowance to healthcare providers because of the COVID-19 pandemic. Now the pandemic has subsided. And somewhere along the line, this particular allowance was supposed to be paid by the facilities. And now the facilities say they cannot pay. During budget hearing, where we had the teaching hospitals and then the regional hospitals coming before the health committee, all of them said that they could not pay and that they were owing the nurses. And indeed, the reason why they were owing the nurses was because of their share numbers. Some of them had paid some small amount to the laboratory people, and sometimes to the doctors. But they were owing the nurses a bulk of the money.
Honorable, are you then telling us that based on your engagement with the executive arm of government, you have now become aware that the government has a challenge paying some of the conditions as stipulated in the agreement between the health workers and the previous administration?
Hello?
I'm asking, are you telling us that based on your engagements with the executive arm of government, you have become aware that the government has a challenge or the government does not want to pay some of the conditions stipulated in the agreement? Is that what you're telling us?
No, the government is ready to discuss the issues. If you say refusal to, the government is not ready to pay all the allowances.
No, but so where are you, Honorable? Honorable, where? I understand, Honorable. Where are you getting the information that the government?
For example, this issue of the payment of 30-month allowance from the budget hearing that we had.
Okay.
With the institutions. where the institution said they could not pay that money. And today I'm seeing that it was supposed to be paid from their IGF, the internal generated funds. And they are saying they cannot pay. And I'm seeing that it has now appeared here as part of the items for negotiation, or the grievances for negotiation.
I see.
So what it means is that the institutions or the health facilities are saying that they cannot pay, and so now it has been sent back to government. The government should pay that amount. And you know the consequences. The consequences is that payment of 30 months' salary could mean that other essential service providers, like Electricity Corporation, Ghana Waters, the military, the police, and all those people can also come and claim that amount of money. 30 months of salary is there are 12 months in a year.
I see. Honorable, let's stick with the health workers, right? Let's stick with the health workers, Honorable.
So this issue like this, they don't need to sit down, see how best they can discuss all these issues and see what they can do about it. That's what I'm saying.
Here's my last question for you, Honorable. When you engaged the executive arm of government, who did you engage, and what was the response to you?
I'm not supposed to be calling names.
Did you engage the health ministry? Yes. Was it the presidency?
You talk to so many people around, yes, but you don't call their names.
No, I'm not asking you to give me names. Did you talk to the presidency, or you talked to the health ministry or the finance ministry?
I talked to the people at the Ministry of Health.
At the Ministry of Health. Great.
Yes.
Now, what is the outcome of that engagement with the Ministry of Health with regards to dealing or solving the situation at hand?
A tripartite committee has been set up, now involving the Ministry of Finance, the leadership of the nurses, who at the time of declaring the strike were out of the country. They were not there for even any negotiations to go on. They were out of the country. And then the Ministry of Health. These three bodies are members of that committee that are supposed to be discussing this issue. Then somewhere along the line, around I think the 2nd of May or somewhere, they failed to turn up for the meeting.
Honorable, we'll leave our conversation here. Thank you so much. Dr. Mark Kurt Nawani is chairman of the Health Committee and member of Parliament for NAPDAM. We'll stay on this story because we need to move on now to the Eastern region, where we understand that, again, this strike is biting hard at patients. Yvonne Nikwe is our correspondent there. Yvonne, paint us a picture. Hello, Yvonne. If you can hear me, I'm asking, what can you report from your region? Oh, those are some pictures from across the regions. This one in particular is from the Eastern region. You can see the empty seats already. The health workers did not show up, and you can tell the patients have taken a queue. They are not there as well. But Yvonne Nikwe will join us in the TAD, will bring us, that's the OPD, and OPD services were cut off a long time, sometime last week. And here we are. It's a full-blown strike, which means that emergency services would also not be rendered by the nurses and midwives. We can now connect with Yvonne Nikwe. Yvonne, paint us a clearer picture of the situation in the Eastern region.
Well, Kameni, here in the Eastern region, at the regional hospital particularly, we're seeing several of the departments getting empty by the hours because the nurses and midwives are not turning up to offer their services to the clients or the patients who are in the ward. We do know that on the average, about 500 patients do come here to have their services. But today, in as much as we're having quite a number of the OPD being attended to by the medical doctors and the health aid, it's becoming overwhelming for them. And so the clients are getting frustrated and they're leaving the facility, unfortunately.
Indeed. Let's take a listen to the new Jabing South Municipality GRNMA Secretary, and then we'll come back to you, Yvonne.
Let me place on record that we are not happy as nurses and midwives to go on strike, but we are doing this to save ourselves, to save our families, and to save the future. Why am I saying so? Nursing and midwifery is an essential care in the country, but I can confidently tell you that we have one of the poorest conditions of service in this country. Let's make reference to other public sector workers. They all have their conditions of service implemented and working. Nurses and midwives are migrating, traveling out of this country. Nurses and midwives are suffering from chronic conditions and at the end of the day, do not have any form of support. Why?
Yvonne, we also see that the OPD is quite empty. Is it that patients are no longer coming in or they have been sent away? What can you report on that?
Well, it's becoming empty because the medical doctors and the health assistants are unable to take care of the overwhelming numbers, and so they have to leave the OPD section and then the other departments. Now, the antenatal place, the ENT and other places are virtually empty now because you find nobody there. Inward as well, we're seeing just those people who are on the ward, but gradually we're seeing that a number of them will have to leave because the nurses and the midwives are not attending to them today.
Yvonne, let's take a listen to that patient you spoke with. But thank you so much for talking to us, Yvonne Ikwe there.
So, no problem. I late in the cafe, no do. A line is where I'm about. No, say. There's a funny baby, and I'm fine if you almost come. No problem. I mean, the beer almost come. I say beer. Walk or baby, in the bedroom, and me will be an and this maybe star was it. Walk or strike, maybe so was walk or strike. My bed can understand me will be our and I'm no poor. We won't about 4 number of who will be brave. Intimate catching was so remember Hannah, may you be a friend so still. May you be a crying, Miss Summer, some cry.
A patient from the Eastern region lamenting the lack of services as a result of the strike action taken by members of the Ghana Registered Nurses and Midwives Association. More on the story now. Here in the capital city, Safua Buahin has been going around some hospitals. She's joining us with the very latest on her observations so far. Safua, what can you report? Oh, it appears we cannot have her now.
Can you hear me?
Yeah, I can hear you. Go ahead.
Yes. So I'm currently at the Adabraka Polyclinic, and it appears that the nurses are really on strike, and they have exercised the full industrial strike today because as at today, the OPD, which normally has the nurses checking the vitals of the patients and clients who troop in, are not there. The only tables and chairs that you meet, and just very few of the clients who are walking about, because speaking to one of the administrative staff, they told us that most of the times the place is it has a lot of people, but because they are on the strike, people come here and then they leave to other places as well. So as it stands now, this place seems to be a very quiet place with just 1 or 2 patients coming around, and the doctors are the ones who are attending to them, and with no vitals check because we don't have any nurse to do that. So I can see that the dispensary is working, and there are some few consulting rooms that these clients or the patients who come up around are able to go to. But the normal process you go through whenever you go to every hospital in terms of you getting your vitals checked, you going, firstly meeting the nurse who would take you to, or who would instruct you to go to this place first before you finally meet the doctor, that is out. That is not there. So you would have to take it upon yourself to be doing most of the things yourself if you indeed need some treatment of the sort. So this is what is really happening at the Adabraka Polyclinic. We earlier also went to the Legon Hospital, and they also appeared for them. They told us that they are fully it looks like we don't have any GRNMA members there. So that is a different story. But for the few that we have been to at the capital here, it looks like the nurses are not at their posts.
Very well.
But we also went to the Ministry of Health, and we have been told that the GRNMA and the Ministry of Health are currently negotiating about this strike. So they are still in a meeting as I speak to you now, and we are waiting for it to conclude, and then we can speak to them on the feedback or what has transpired after the negotiation. So this is what I can say for now with what has been happening so far. Over to you.
Very well, Safua. Thank you so much for the report.